Welcome back. Let's turn now to a discussion on the coronavirus pandemic. Worryingly, a new study has found that the Pfizer vaccine is less effective against protecting against those Delta variants. We're joined now by Dr. Anthony Santella from the University of New Haven, where he's a professor of health administration and policy. He's also the university's coordinator for COVID-19 response. So Doctor, I'm curious to know, because this is incredibly worrying. We had consistently been told, that these vaccines will still protect us against the Delta variant and also that mutation, the Delta plus mutation. Do you imagine that we're going to continue to see more and more breakthrough cases of people who are vaccinated and still become infected with coronavirus because of the easily transmissible nature of this variant, and also how it's more severe?
Yeah, well, first, thank you for having me here today. The Delta variant is an important part of our conversation. We talk about a public health-driven, science-focused response to COVID. And as you know, it's very transmissible. It's causing severe illness and hospitalizations, particularly amongst those who are unvaccinated. But this shouldn't surprise us too much, because this is what viruses do. They evolve, they mutate as they replicate and spread through the community. So while we're in a good place in terms of the United States pandemic response, we can't let down our guard. We need to continue putting out the messages on why people should get vaccinated, even if they kind of thought, I'm a little reluctant, I'm hesitant, but, so many people are vaccinated, I don't need to do it. It's not too late.
Doctor, I want to ask about something we're seeing take place in France, where we have seen another surge of new coronavirus cases. And it looks as though people with compromised immune systems are now being given boosters if they've been fully vaccinated. We haven't started to see that here in the U.S. Is that something you think maybe we should be doing sooner rather than later, especially given the fact that this Delta variant seems to be, gaining steam here?
Yeah. So boosters are an important part of our conversation right now. And biotech and pharma really are figuring out when we need those, if we'll need them, or perhaps those will be, only for people who have compromised immune systems, major underlying illnesses. But the conversation really is around maybe in the 8 months to 12 months post both doses or the single dose, we may need to get revaccinated. And then what does that look like as we enter flu season? There is this conversation about, combining a COVID-19 vaccine booster along with potentially a flu shot. And so there are a lot of conversations happening, but most likely many of us, particularly those who are most vulnerable, will need a booster.
So, Doctor, I'm curious to know how you think this might impact travel. We're seeing, at least when it comes to Europe has said, hey, we're happy to have American tourists, especially if they have been vaccinated. But if it is looking like these vaccines are not as effective against protecting against the variants, is there a concern that perhaps Americans can go abroad or go overseas and bring the virus back with them and pass it along to either other folks who are vaccinated or perhaps those unvaccinated individuals that are still here in the U.S.?
Yeah. And I say this also from a personal perspective. I'm that person who loves to travel, jump on a plane. I got additional pages sewn into my passport. I'm a globetrotter. I love to be, experience new cultures and new places. However, now is just not the right time for me to be doing that global travel. And I say the same to my friends and loved ones and my colleagues. We have to also remember, in addition to not knowing how the Delta variant is in other countries and new and emerging variants, we also have to remember that there are pockets of individuals who are traveling who remain unvaccinated and will continue to drive community spread. And so between not knowing really the state of affairs here in the US, going somewhere abroad or even within the US that may have lower rates of vaccinated individuals, we're going to continue to see an uptick in hospitalization, severe illness, and unfortunately death. So, while travel is safe, you have to decide what's best for you. So you might continue to see people with wearing masks who are vaccinated. And we should learn, not to make assumptions about those individuals. Everyone has a right to protect themselves and the people around them. And so let's just, be a little more patient. I know everyone really is fatigued when it comes to all things COVID, but we're so close to being in a place where we can resume our normal daily activities as if it were pre-pandemic, but we're just not there yet.
Speaking of which, Dr. Fauci recently said that he himself would wear a mask, even though he's fully vaccinated, in areas where there are low vaccination rates. I'm curious if you would do the same thing.
Yeah, I am doing the same thing. So, I carry my mask with me. I use my best judgment. Now, I have the luxury of being a public health scientist and I study infectious and communicable diseases. So, I know a little bit more than the average person, but I judge the situation I'm in or the surrounding area that I'm in. And it's, you really never know who's vaccinated, who's not, just because there are these, local jurisdiction and state guidelines that say, if you're unvaccinated, you can do this. If you're vaccinated, you can do this. You can't make assumptions about people just because if you see them wearing a mask or not. So if I'm in a more crowded place, an indoor place that's more densely populated, you might see me with a mask on. When I'm walking around campus or I'm walking in and out of a building that doesn't really have a lot of people moving in and out, I may not have the mask on, but I've been fully vaccinated for the last several months. So, it's a little bit different. But yeah, err on the side of caution. That's really my bottom line here is, we've worn masks for so long. To wear them indoors or in crowded places just for the next few months isn't a bad idea.
All right, Dr. Anthony Santella from the University of New Haven, thanks so much for joining us today.